Hey everyone, it's Trumia, and I know it's been over a week since I've posted, and it's been like a really emotional, I guess, last 2 weeks, last 2 months, last year, I don't know, but it's finally caught up with me. It's one of those weeks where you get your answer from the doctor, but the answer just brings up more questions. And you get the answer and it brings up more questions. And, so like I was waiting to get my final answer to make a vlog, and I'm still waiting on that answer. So here we go. I had the biopsy done of my cheek, and the stitches were taken out on Tuesday. And actually my dermatologist called me on Monday and left a message. I didn't make it to the phone. But, there were some concerns with the report. And so she contacted Dr. Burt, my stem cell doctor in Chicago. The dermatology, the pathology report keeps on coming back graft versus host disease, which is normal and common in transplants where you receive another person's blood, like stem cells or their heart or lungs, you receive somebody else's stem cells. Mine, I received my own stem cells. And so, it's like, well, how is this showing up? And the report says it's consistent with graft versus host disease. And then we come to the point to basically where oncologists say, no, it's not possible. Dermatology in their reports, in their, the books they write, the journals they write, it's a possibility. And so I know everybody thinks my face is looking great. And yes, compared to what it did when it was just all bloody and raw and totally open, it looks so much better. But the sun's shining in on me weird, but my face still, it feels like sandpaper. I'm getting these really dark brown spots. If I do not put steroid cream on it twice a day, it gets inflamed and really red. And no, it's not a butterfly or malar rash. So something, is going on. And to me, whatever it was that planted itself on my face on May the 12th is still here. I've never fully recovered from it. It's still there. And so that brings up the question back and forth, what is it? Because, they gave me a great big long name of a virus and said, like I'm number 17 in the world. And when we went to, okay, mind you, my initial reports from my dermatologist and the pathology here, it came back, consistent with graft versus host disease or eruption of lymphocyte recovery. And, but the experts and the specialists in Chicago said, no, it's not that. It's this great big long virus, and we're going to treat it as such. But to get the complete and full answer, we have to send off the slide strips to, I believe it was Switzerland, and it's going to take 2 weeks. And so they gave me the cream to start putting on my face. And remember, that cream cost $53,000? And then, kept on doing it, said it's going to get worse before it gets better. I remember them saying that. And then I just try not to think about how bad my face was, how bad the pain was. And then, I went septic from the infection of it all. My ears falling off. I'll put the down in the comments. I'll put the link to my video of like the progression of how my face went, and so you guys can watch it again if you want to. I can't watch it, but when I went back to Chicago, when the face was horrible, the dermatologist said, "Oh, well, we got the report 10 days ago, and it wasn't that virus, that particular virus that they thought it was, that they were treating me with that cream for." And he goes, "We got that 10 days ago, and you were supposed to stop the cream." And, and I said, "Well, nobody notified me." So I had 10 days of putting that cream on my face, which is what led to all the eruptions of the lesions and everything. So I had 10 extra days of, basically killing myself that I didn't need to be. And he actually pawned it off on the infectious disease doctor, saying, "Well, he jumped the gun in treating you for that infection." And I said, "Well, wait a minute. You both were standing here in this room and agreed that that's what it was." So he dismissed himself from the room. So, like, those two doctors I just have issues with. And I let it be known this time around that if I have to deal with dermatology and infectious disease, it's not going to be with those two doctors. And I know the two doctors that I respect in those offices and the doctors that I want to use. But I guess today's Friday, first part of the week, initially Dr. Burt had told my nurse liaison that he wanted me in Chicago. And it's just like, man, I just can't be jumping on a plane every time. And, it's just like, I did not expect it. And so finally we sent the pathology slides from my dermatologist to Dr. Burt overnight. And he got those Wednesday. Unfortunately, he didn't get a chance to look at them Wednesday. And then Thursday he was out of town, but he's back in town today. But my nurse liaison only works Tuesday through Thursday. So I'll possibly might hear from Dr. Burt. He calls me directly. The man is amazing. All my doctors here love him. They said he is the most kind and compassionate doctor they have ever dealt with, and the most organized. When they call him about me, he either gets on the phone immediately or calls them back within 5 minutes. And then after they hang up, within 5 minutes, they have an email from him stating everything they just discussed and the follow-up procedures. And I believe my home health care is here. Buddy's barking. But anyway, so I'm still waiting for answers. How we're going to treat it, what we're going to do, I don't know. If it was graft-versus-host disease, the treatment is high-dose IV steroids. But I don't think it's graft-versus-host disease. For one, it's my own stem cells. Two, since this virus, I've been hospitalized 5 times, and each time I received 3 days of 1 milligram of Solu-Medrol. And it's still here. And so I don't think it's that, and the Solu-Medrol wouldn't be the correct treatment. The cream that we put on my face didn't work. It's still here. And I told my nurse, I said, in no uncertain terms, I will not do that treatment again. I will not. Nobody better bring it up to me. It is not an option. And so, like, immunosuppression is on there. So chemotherapy is another possibility. I saw my rheumatologist yesterday, and she said if I'm given options, chemotherapy is the way for me to go, that my body cannot tolerate any more steroids. And I agree. And one of them is, unfortunately, I've put on so much weight I'm having severe shortness of breath because, you know, you put on the weight through here and around your midsection, and so it's just compromising my breathing. And so now I've got to do something, and I'm going to have to talk to my home health care about it, because I've got to start getting some weight off one way or the other. And, you know, it's the Cushingoid syndrome. And because I kept on saying, I'm fat, and I finally said, I'm not going to say that anymore, because I didn't do this to myself intentionally. The truth is, it's Cushingoid syndrome. It's part of the disease process. It's part of the treatment. It's not my fault. Trumia didn't do it. It's Cushingoid. Just like if you say it's lupus, you know, you don't say, oh, you know, you don't put yourself down about it. So I'm going to start referring to it as Cushingoid. I'm Cushingoid, and due to that, this weight has got to start coming off. And I had already been cutting back my portion size and everything, so at least I'm in the process. I can't do it all at once. I just don't work like that. Like, I can't cut myself back calorie restriction wise, or I'll fail. I know that's how I work. I can take it one little step at a time, and it'll quickly add up. So I don't know what my future holds. You know, if it's going to be the chemotherapy, I want it done here in Oklahoma City. For my IVIG, the doctor here, the stem cell doctor, does it, and we do it over here a mile away at the ProCure Cancer Treatment Center. He's very compassionate in meeting your needs and everything. Come in! So that's where I want it done. See you guys in the next video.